Both the DSM-IV-TR and the DC-0-3 utilize a multiaxial system of diagnosis. A multiaxial assessment system addresses an individual's functioning on several different domains that are relevant to treatment planning and potential outcomes. In the DSM-IV-TR, Axis 1 indicates clinical disorders. Individuals can have more than one Axis 1 disorder, and in fact this is quite common. If someone does have more than one Axis 1 disorder, the principal diagnosis or presenting problem should be listed first. Axis 2 is for personality disorders and mental retardation. A personality disorder is defined as an enduring pattern of inner experience and behavior that deviates markedly from the expectation of an individual's culture, is pervasive and inflexible, has an onset in adolescence or early adulthood, is stable over time, and leads to distress or impairment. Axis 3 lists general medical conditions that may affect any psychological treatment. Axis 4 is for documentation of relevant psychosocial and environmental problems. Examples of this may include things like homelessness, poverty, death of an immediate family member, and lack of social support. Axis 5 is the Global Assessment of Functioning, or Gaf Score. This is a clinical rating of the client's overall level of functioning on a scale of 1 through 100, where 100 indicates superior functioning in all areas, and a score of 10 indicates that the individual is persistently in danger of hurting themselves or others. This score can be very useful in providing a quick snapshot of someone's overall level of functioning. However, one of the major changes in the DSM-5 has been to eliminate this score. The DC-0-3 uses a similar system for diagnosis, but the axes have slightly different purposes. Axis 1 is exactly the same as in the DSM-IV-TR, clinical diagnosis. Since personality disorders would not yet be evident in infancy and early childhood, Axis 2 is designated for relationship disorder classification. When a relationship disorder exists, that is specific to one individual relationship. For example, an infant may have a disordered relationship with one parent and a healthy relationship with the other. There are two different ways to evaluate a relationship classification for Axis 2. The first is the Parent-Infant Relationship Global Assessment Scale, which is a scale of 0 through 100, where a score of 91 to 100 represents a well-adapted relationship, and a score of 0 to 40 represents a disordered relationship. The area in the middle would represent relationships which show some tendencies toward a disordered relationship, but do not necessarily fall into a disordered range. The other way to assess relationships for Axis 2 in the DC-0-3 is the Relationship Problems Checklist. Using this tool, each quality of the relationship is described in terms of characteristic behavioral quality, affective tone, and psychological involvement. Again, like the DSM-IV-TR, Axis 3 provides a space to list relevant medical and developmental disorders and conditions. Axis 4 is a place to note relevant psychosocial stressors. And finally, Axis 5 gives a snapshot of the child's overall emotional and social functioning. In the DC-0-3, this is accomplished by rating 6 specific capacities for emotional and social functioning. These 6 capacities are attention and regulation, forming relationships or mutual engagement, intentional two-way communication, complex gestures and problem solving, use of symbols to express thoughts and feelings, and connecting symbols logically to abstract thinking. For each of these capacities, the clinician assesses how the child functions in terms of age-appropriate skills.